Hi, I'm Taylor McFarland, a board-certified pediatric dentist currently working in private practice in the Eastern United States. And I'm a mom of 3 kids ages 6 and under. Be sure to find me on TikTok and Instagram for short-form content as the Mama Dentist. You might be surprised to hear me say that my youngest just turned 2. And yes, she will sometimes even nurse at night after I have brushed her teeth. But she's cavity-free. Now, me saying that out loud as a dentist, putting that out here on the interwebs for all of the other dentists to see and judge me by, if that doesn't deserve a like, I don't know what does. But in all seriousness, I hope you feel safe now. Can I just tell you that I have exclusively pumped and bottle fed one child until 14 months. I have formula fed and nursed another until age 1 and am still nursing another child beyond age 2. So my experience is quite varied. You'll find no shame here from me regarding how you choose to feed your little one. This is a mom shame-free zone. I'm just here to give you information and share my experience as both a mom and a pediatric dentist so I can help you make the decision that is best for you and your little one. If you like the sound of that, please hit that subscribe button and we'll get going. So tell us, doc, does breastfeeding cause cavities? Let's get into it. So where do cavities come from? Bacteria. Bacteria sit on and between our teeth as plaque. And our dietary sources of sugar and also starches provide a food source for those bacteria. They then eat the sugar and poop out acid. And this acid over time is what weakens our enamel and leads to holes in our teeth known as cavities. The question then is, can breast milk, and important to also note here, can formula serve as a food source for these cavity-causing bacteria? Yes. There are natural sugars in milk and formula, lactose most notably, that Streptococcus mutans and other bad bugs or germs digest and then produce acid from them. So are we done for? Do we need to start weaning our babies as soon as they get teeth? Some dentists out there have led some people to think that's true, but no, I don't think that's the case. Let's talk about some other important factors to consider. First, are all bacteria bad bacteria? Do we need to invest in some baby Listerine and get rid of like 99.9% of all of these germs? No. In fact, babies aren't born with cavity-causing or gum disease-promoting bacteria in their mouth, but there are lots of good guys present. The mouth is the gateway to the gut, and the formation of a healthy oral microbiome also helps babies developing digestive systems. So bacteria, by and large, are a good thing. They're an important part of our overall health. But these bad bugs can be concerning. And you know what? These bad bugs have to be introduced to them. That's where the next factor becomes important. And that factor is transmission. Many studies in the early 2000s explored the idea of transmission of cavity-causing bacteria between people. They found that caregivers can pass strep mutans on to their children, as can kissing partners and daycare playmates, but that's another video for another day. We've learned more since then that cavities aren't necessarily a contagious disease per se, because although it is caused by bacteria, it requires a shift of the microbiome to favor them and for them to dominate over time. So small, infrequent exposures to these bad bugs for someone with a fully competent immune system and a mature, healthy microbiome, it's really not a big deal. But babies are still working on gaining immunocompetence when they arrive, and their microbiomes are just beginning to form. So early, frequent introduction of aggressive, cavity-causing bacteria to them can prime their microbiome to favor the bad guys early on, potentially placing them at higher risk for cavities in the long run. So what does this mean? We need to do what we can to prevent baby from being seeded with bacteria associated with an unhealthy mouth, like those linked to cavities and gum disease. And what does that look like? You want to limit their exposure to other people's saliva. This may mean ensuring that your own dental health is in order as much as possible before baby arrives. Pregnant patients can and should visit the dentist. So don't stop until you find one who is comfortable with treating a pregnant person. But I know for many people, access to quality dental care and affordable dental care is an issue. So I give you this tip. If perhaps your mouth isn't in a state of optimal health, what can you still do to help protect baby as much as possible? Xylitol. Some studies show promise with xylitol exposure in pregnancy via gums, mints, or lozenges. It can reduce the transmission of strep mutans from the mother to the child. Side note, most mints have 0.5 milligram of xylitol per piece, and most gums have 1 milligram of xylitol per piece. If the ingredients on a gum list xylitol, but they don't show in the nutrition facts the amount per piece, then they may not have very much. But the ones that have that full gram per piece, they're going to be proud and show it in the nutrition facts. For example, this is pure gum. And if you look on the back, serving size 2 pieces, and then 2 grams of xylitol. It seems that long-term use over several months of 6 to 10 grams total of xylitol per day, 3 to 7 times per day, has the most potential for benefit. But be cautious with the use of xylitol if you are sensitive to sugar alcohols. It can cause GI discomfort or distress for some people at elevated doses. Also be really careful if you have dogs around, especially if they are curious and get into things. You want to keep it away from them because a dog ingesting xylitol, even a small amount, could be fatal. It's toxic to them. And thirdly, if you have TMJ pain, chewing gum obviously can exacerbate that, particularly if you're doing it multiple times per day. So you may want to reach for the lozenges or the mints instead. On a personal note, I found chewing xylitol mints and gum also helped manage my acid reflux during pregnancy, which benefited my own teeth by reducing the negative impact of that super strong stomach acid exposure. A lot of women during pregnancy experience dental issues. It's because of acid reflux and vomiting from morning sickness, and that stomach acid is so strong and it erodes our enamel and weakens it. Xylitol is also helpful in that regard with morning sickness. You want to chew it after you rinse your mouth out with water because chewing stimulates salivary flow, and it is that saliva that is going to help remineralize and heal your enamel after that acid attack. You never want to brush your teeth right after acid has been in your mouth, whether from food and eating, whether from acid reflux, whether from vomiting, because that acid has already weakened your teeth, and brushing with that abrasive toothbrush, even though it's not super abrasive most of the time, in the presence of weakened enamel, it can be, and you can wear your enamel away. So always rinse first and then try to neutralize that pH by stimulating salivary flow like with chewing xylitol gum. But real talk, sometimes transmission is unavoidable. We live in the same family, they have siblings, they're sharing toys, there's slobber being transmitted between siblings. I'm gonna kiss my baby on the lips sometimes. So maybe if I've got cavities, they are introduced to those cavity causing bacteria. What then do we do? The simplest solution if baby does happen to acquire these bad bugs is to prevent them from overtaking the place. Begin establishing an oral hygiene routine even before baby's teeth arrive. So you can just take a washcloth and wrap it around your finger at bath time, and then just run that damp washcloth in their mouth along their gums. You can stretch along their cheeks and just get them used to the idea of taking care of their mouth along with everything else. It's just part of the normal routine. Once their teeth do arrive, use fluoride toothpaste to help strengthen the enamel via fluorapatite formation. And I want you to see the cards here for more information about how fluoride protects our enamel and is safe to use for baby in the doses recommended by the AAPD, the American Academy of Pediatric Dentistry, if you have questions. You want to establish a routine that includes brushing twice daily, especially at night before bed. Commonly missed areas with brushing include the gum lines, both of the molars and the front teeth. Generally, we have to get the lip up and out of the way or down and out of the way, and then move the cheek to the side. The tongue can also be in the way, and that is where a triple-sided toothbrush can be helpful to access the gum line on the tongue side. The final area that is often missed is the tongue side of the front teeth. Be sure you're turning the toothbrush straight up and down and then brushing the tongue side of those top and bottom incisors. Don't miss the backs of the top teeth or the gum lines underneath the lips and along the cheek and tongue side of the molars. A triple-sided toothbrush and a brushing buddy can be helpful tools. I go through those in a separate video about how to care for your child's teeth that I'll link here in the cards too. Then the final factor we'll talk about modifying is the bacterial food source, the formula or the breast milk. But I'm going to argue that it's not so much what we are feeding them, something that has sugar, but what is important is how often and when. Although yes, sugars are present in milk, they're going to be present in any adequate source of nutrition for a baby. So it's not like we can get rid of sugars. And if they're eating overnight and that's what they're primarily eating right now is milk, what then are we to do? Reduce frequency. If the mouth is dried out overnight, which it is, and the bacteria are multiplying unchecked, we don't want to keep providing a food source for their little party. It'll turn into a rave. Similarly, because the saliva supply in our mouths is low overnight, it's difficult to remineralize any weakened areas of enamel. So let's not kick a guy while he's down and keep pummeling acid on every hour when he still hasn't fully recovered from the last exposure. So if you take one piece of advice from this video, let it be this. Try to reduce the frequency of exposure to milk overnight. That means don't leave a bottle in bed for baby to reach for and sip on all night long. Whether that bottle contains juice, formula, or breast milk, it all contains natural sugars, and if they have unfettered access to it all night, they may sip on it all night long and frequently expose those bacteria to that sugar, and they'll continue to churn out acid all night. This also means that in terms of their cavity risk, it may be beneficial beyond 1 year to reduce ad lib overnight breastfeeding. Try not to let them become a snacker overnight. If the baby's healthy and developing typically and beginning to eat solids, then talk to your pediatrician because they do not likely need that milk as a nutrition source overnight. It is a source of comfort and connection, yes, absolutely, but working to provide that during waking hours and at that last session of nursing before bed and not overnight will help reduce their risk of cavities. But what if you just cannot stop overnight feedings? Your life situation, your sleeping situation, whatever it is, you just can't. They're frequently nursing overnight beyond 1 year. What can you do then to mitigate risk? If you're struggling with weaning from overnight nursing and your child is older, beyond 1 year of age, I want you to work closely and be honest with your pediatric dentist. I'm going to link here in the cards another video that talks about the importance of establishing a dental home by your child's first birthday or within 6 months of their first tooth coming in, whichever is earlier. That's when you should be seeing the dentist. Within the time frame of these nursing potentially difficulties and teething, all those things, you want to see the dentist now. Early detection is key to stopping them in their tracks and keeping them from progressing to something that you might potentially need to treat with fillings or crowns. pounds. You also, with home care, want to be really diligent and be sure you're cleaning off the bacteria from those teeth very, very thoroughly before bed. That means you want to be lifting their lip, brushing up along the gum line, and then also on the back side of the teeth very well. Your pediatric dentist may also want to place your child on prophylactic fluoride varnish therapy. That's a little paint they put on the teeth at the end of a cleaning visit. Sometimes we'll do those more frequently for children who are at higher risk for cavities. It would occur between their 6-month checkups, typically at 3-month intervals. This will further strengthen their enamel and protect their teeth from the development of tooth decay. You can also use fluoride toothpaste with brushing at home in the grain of rice-sized amount recommended by the American Academy of Pediatric Dentistry. And then you want to try and wipe their teeth off after each night nursing session if you can. If they're asleep, you can wipe them. You can use something like a Xylitol tooth wipe or a spiffy wipe. I'll show an example here in a graphic, or just a damp washcloth. If they're awake, try to have them take a drink of water to wash that milk away. There are lots of ways to lower their cavity risk and continue to nurse as long as you and your baby want to continue doing so. As a mom and dentist, I'm tired of the mom shaming related to nursing beyond a year. The vilification of breast milk and of mothers who choose to nurse their babies beyond 1 year of age is misguided. There are many factors at play in cavity formation, as you just learned, and many mothers successfully nurse their children well beyond age 1 and the kids remain cavity free. So let's summarize. If you're continuing to nurse beyond age 1, especially overnight, and all the more so if it is frequent exposures overnight, what can you do to mitigate that increased risk of your child developing dental decay? 1. Be sure your own mouth is in a state of health, cavity-free if it can be, from pregnancy and on through your child's first years of life. 2. Minimize transmission of cavity-causing bacteria via saliva to baby, and that can be from you, from siblings, or from other caregivers who have mouths that are not in a state of health. So you don't want to share utensils, straws, food, cups, toys. You don't want to lick pacifiers to clean them, and then as much as possible, try not to kiss them on the lips. 3. Some studies show chewing xylitol gum during pregnancy 3 to 7 times a day for a total dose of 6 to 10 grams of xylitol a day can help reduce the virulence, the meanness of Streptococcus mutans, and make it less likely that they'll be transmitted to babies. So if you have mouth diseases that you're unable to treat, this, along with care to not expose baby to your saliva, is a good strategy to help minimize the risk of transmission of those bad bacteria. 4. Brush their teeth thoroughly twice a day, especially at night, and use a fluoridated toothpaste in a grain of rice-sized amount. 5. Establish a dental home with a pediatric dentist within 6 months of baby's first tooth coming in or by their first birthday, whichever is earliest. Consider more frequent in-office fluoride treatments if that's recommended by the dentist. 6. Know and watch for the signs of early cavities, most often the white lines along the gum line. It's also good practice to check the back side of your baby's teeth, make sure there's no yellow or brown discoloration. That could also be cavities hiding out where we can't see them easily. 7. If baby is still awake after nursing overnight, have them take a sip of water to wash off the milk, but if they're asleep, just try to wipe their teeth off with a damp washcloth, or you can use a Xylitol wipe. 8. As much as possible, aim to reduce the frequency of overnight ad-lib breastfeeding once the teeth arrive, especially beyond 12 months of age. Don't leave a bottle in bed either with any sugary liquid that they could access all night long. I hope this video eased your mind and helped you see that it absolutely is possible to continue breastfeeding beyond 1 year of age and keep them cavity-free. I'm right there with you, 25 months, and we're still going strong. If you're looking for more shame-free tiny teeth tips from a mom and a pediatric dentist, be sure to hit that subscribe button. I've got lots more coming your way. Thanks for watching.